I think that there is a certain level of urgency around delivering palliative care to the homeless population. These people have been shortchanged for a very long time, and there is no time to wait around.
We see a lot of ill health in this population, and a lot of ill health at much younger ages. So the mean age of death is in the 40s for both men and women. And we see that people live in ill health for a good proportion of their lives. And we see that that ill health advances earlier. So providing good care, which then becomes palliative and ultimately end of life, is really important to that overall holistic care for people experiencing homelessness.
Improve is the intervention to optimise palliative care for people with lived experience of homelessness. We have 8 sessions that cover a range of different topics, and we've worked with our lived experience group to identify what those topics would be. And what we're doing with Improve is giving people the time and the space and the connections to bring different perspectives and think together about what's possible and to challenge those things that don't seem possible yet.
I think for a lot of practitioners, having a community of practice as a platform to discuss things and to learn things is invaluable.
When we first started, it was a new concept to everybody that came, and I think it's taken a number of months for people to sort of settle into feeling comfortable being here and sharing cases. I know that since we've started, people have been reaching out to each other outside of meetings, which is great, because primarily what we wanted it to be was an opportunity to build stronger networks with groups that are doing good work, often in silo, and trying to sort of break some of that down. I feel like every time we meet, I'm blown away by the work that these people had been doing, and a lot of the time single-handedly. And so this group has helped bring us together so that we can help forge those connections, make them stronger.
We've got a group of people I can pick the phone up and say, I'm not sure what to do with this poor chap.
Knowing the services that are available, just listening to them, being able to pull just in the meeting, just being able to say, can we get help here? That's absolutely fantastic.
Being the hospital liaison, it's great because I'm picking up so much more terminology. I'm able to pick their brains now.
It's a feel-good factor when we leave, that we've actually discussed things, perhaps not always agreed, but it's opened out views, and it's been so informative throughout. I think it's made me open up more because I've been so used to working on my own.
And I think this group has made me feel more confident to talk out in other settings to sort of champion why this work is important.
In building those connections, actually we're able to respond to people's needs more quickly and in a timely way. And that was demonstrated recently when the emergency MDT really needed to be put into place. And so with everyone's connections, that happened really quickly, and there was a really large attendance.
We would never ever mix with consultants. We wouldn't be able to get to them, to be able to talk to them about cases. It's absolutely brilliant how this has opened up communication between housing authorities and hospital staff. And you get to talk it out with people who actually understand what you've gone through and what your tenant went through, what your person went through.
So I did go out with the team recently. I joined the community mental health team and one of the outreach homelessness practitioners on the wellbeing van in Nuneaton. And I was asked to see a gentleman who lived nearby. He hadn't arrived at his appointment time, so they suggested I went to see where he was, and I said, absolutely, that's fine, let's go. So we did. He had a makeshift shelter up on a roof in town, so we went up the fire escape and met with him.
I think that's a real kind of success. Obviously that never would have happened before. They wouldn't have got to see a palliative medicine consultant.
We all trust each other and we all offer advice and support, and ultimately it's to help the homeless individual. It's not about us, it's about them.
If we all remember how amazing it feels to do that work together, like when all of our agencies come together and we do achieve something for someone, it feels incredible.